should be securitized to give priorities on expenditure during this pandemic, because we do not know when. You can see how the world is struggling with the vaccines. And we urge you, Minister of Health and Finance, please speak from your hearts on these matters, because Dr. Podoe and the team, they have done theirs. It is your turn, as we conclude this motion, that you submit to our full satisfaction. Madam Speaker, I beg to move.
Honorable Atiku, 3 minutes. Honorable Nambeshe, 3 minutes. Honorable Nawat, then I will go on. Honorable Waru, Honorable Tomoranda, Azza, Kenneth, then I take the ministers.
Thank you, Right Honorable Speaker. I join colleagues in appreciating and congratulating the team led by Dr. Joseph Epodoi from Soroti Regional Referral Hospital upon this motion raised by the Honorable Elijah Cooper. Madam Speaker, just like colleagues have said, what this team has done embodies professionalism, heroism, and patriotism, something that was least expected from a regional referral hospital of Soroti Hospital's status. I speak with experience, Madam Speaker. There was a time a baby with heart complications was sent from Arua Regional Referral Hospital. And this baby and the parents were not attended to and were referred back painfully by the gatekeeper from Mulago Referral Hospital, National Referral Hospital, to go and die. When I raised this matter to the Minister of Health, she disputed my plea and claimed that I was lying. And we had an exchange, a bitter exchange. But these are facts which are happening at Mulago Regional Referral Hospital. I can imagine the pain with which the parents of these conjoined twins left Mulago, which has been equipped, referred to now as a specialized super national referral hospital that cannot perform what Soroti Regional Referral Hospital did. Madam Speaker, things can be done. This government has put resources through this parliament. Actually, we approved loans here to revamp the general hospitals. I can give with vivid examples. Kayunga. If you went to Kayunga, if you went to Yumbe, you will find facilities that you cannot even find in any of the regional hospitals. But what is going to let down the service delivery in those facilities is the lack of human resource. So, Ministry of Health, why are you allowing our people to die when resources have actually been put to your use? So, Madam Speaker, there is lack of prioritization and proper deployment of resources in Ministry of Health. Today, as we speak on this motion, the team from Soroti has demonstrated to us that actually we have resources, we have the will, but the commitment of the supervising entity, which is the Ministry of Health, has failed to do its part. Madam Speaker, as I wind up, since time has not been on my side, members have said, yes, the team here deserves a golden handshake and this and that. On a good note, Madam Speaker, allow me also to appreciate this House for commending the work that was done by our nurse from Arua, who willed a patient under lockdown, yes. Madam Speaker, this nurse was awarded a scholarship to pursue a diploma up to degree level. She was recognized by the National Council of the Nurses and Midwives. Madam Speaker, this nurse was also given a golden handshake, whose amount I will not mention here, by His Excellency Yoweri Kaguta Museveni, the President, and processed by our former colleague, who is now the the Honorable Dr. Omona. So there should be no reason why this one here, the same Dr. Omona, should also process something to appreciate this team from Soroti as quickly as possible. Madam Speaker, on a personal note, the child that was saved under this mysterious circumstance, which I would like to call a miracle child, has a future. How we secure this child's future to come and give the testimony, even when we are no longer there, is important, Madam Speaker. And on behalf of Uganda Parliamentary Forum for Children, we would like to pledge a fund for supporting this child, beginning with May this year, with 2 million shillings from my personal account. That money can be deducted from my monthly salary of May to start a fund for saving the future of this child, be it academic or whatever. I thank you, Madam Speaker.
Thank you. Una Nambeshe. Nambeshe na what Augon, Briwaru, Tomuranda, Alsa, Kenneth.
Thank you, Right Honorable Speaker. Let me join colleagues to pay glowing tribute to Dr. Joseph Podoi and the team for providing leadership in performing those very complicated, high-risk surgeries of separating the conjoined twins and the other one of delivering a mother whose baby was implanted on the liver. But most importantly, Dr. Podoi, we come from the same region. I come from the disaster-prone district of Duda. And there are good testimonies made by some of the people you worked on. There is this disease, which is a neglected tropical disease, hydrocele. Hydroceles were rampant in that region. But courtesy of the efforts and the blessed hands of Dr. Joseph Podoi, he has conquered and wiped them out. And I want to congratulate her upon that. Madam Speaker, I was perturbed by the Honorable Minister when he was here lamenting, and particularly when he praised, and rightly so, His Excellency, the President, for championing the fight against coronavirus successfully. But equally, having an axe to grind with him for not championing the fight to ensure that healthcare services are improved. Madam Speaker, this is insincerity of the highest order. Because in the cabinet where they sit, why can't they speak truth to power? Why is it that they only come here and think that this is the only right place where they can address the chair, and the chair is you presiding, all right? But the chair in the cabinet, incidentally, is by virtue of his office, the president is the substantive minister of finance. And by the way, we have Operation Wealth Creation, but health is wealth. And this Operation Wealth Creation has so many sisters, Myoga, Youth Livelihood Funds, whatever, name it. But why can't we also initiate an Operation Health Creation in Uganda? If ministers can come to the house and in sincere tones articulate issues which could have rightly been and eloquently been articulated before the head of state. Madam Speaker, you realize that the dilapidated state, the infrastructure in Soroti.
Yeah, Honorable Nawat. No, Nawat. Nawat Augon, Briwaru, Tomuranda.
Thank you, Madam Speaker. And I would like to join colleagues in applauding Dr. Podoi and his team for their bravery and confidence in conducting that risky surgery. The people, the relatives of those patients, the patients themselves are very happy and proud about you. I'm equally proud of you, and I believe all Ugandans are proud of you. Thank you so much. Madam Speaker, for those of us who come from rural districts, when civil servants are posted there. They stay for a very short time. Then they seek transfers to the towns. And then they also go to look for greener pastures. But Dr. Podoi and his colleagues have exhibited that they are ready to work and save lives of their brothers and sisters, despite the harsh working conditions. This should not be taken for granted, Madam Speaker. They should be supported and motivated so that they can save more lives. Let government make their working conditions conducive. Madam Speaker, I sit on Park Central, and we've been interacting with accounting officers from these regional referral hospitals. Madam Speaker, like colleagues have mentioned, there are a lot of challenges ranging from infrastructure, equipment. They lack machines like the scanners, like the MRI machines, like the oxygen plants, and where they exist, Madam Speaker, where they exist, they are broken down. And sometimes there is no power even to run those machines. Madam Speaker, there is also the problem of critical staff. We are told that because of the small pay given to these specialists and doctors, most of them hoped to go to the teaching hospitals where the pay is attractive. So, Madam Speaker, there is need to pay attention to this staff in the regional referral hospitals. Madam Speaker, like members have said, let government look for money to revamp our regional referral hospitals and even the lower health units. Madam Speaker, as we wait for that, as we wait for government to plan for that, let us begin with the Roti Referral Hospital right from the coming financial year so that their neighbors can learn that good work can be rewarded. And Madam Speaker, Soroti Hospital doesn't serve only those districts of Soroti. Even us all the way from Amudat, Madam Speaker, recently some patients from my district were referred to Soroti. So let government revamp Soroti Hospital so that the referral. Let Soroti Hospital be revamped so that the referral services can be taken closer to the rural population. I thank you, Madam Speaker.
Thank you, Honorable Waugon, then Honorable Adruwaru. Now, Tomuranda, Azza, please, I think you move closer.
Right, Honorable Speaker, you have always done certain things that some people have failed to do. As we stand and sit here, for me, I beg of you to do the usual things you do here. Let us decide if we are going to give money to Soroti, let us give Soroti money. It is our mandate. Madam Speaker, you chair. For us, we are here to support. What we need to do is to put what we have spoken into action. This thing of begging to Minister of Finance, begging to so and so, it can't help. This is the National Parliament. Right, Honorable Speaker, we have the mandate, moreover constitutional. It is written in the Constitution. What else do we need as a parliament? We just need to sit here and act. Nobody should be making us to beg. Soroti is squatting in terms of what it needs. Do we need to beg anymore? How many committee trips do we need to make to Soroti as a hospital so that action is taken? No, Madam Speaker, no. For me, it is the right time for us to take action. If we decide to give them 100 billion, so it be, let it be, because we are the ones who have the mandate. Who else? We appropriate even for security, even for the president. It is our mandate, Madam Speaker. Dr. Podoi should now be driving a special car, customized, a Podoi. Yes, so that when he passes in the streets, everybody knows that's a Podoi. I can tell you, Doctor, from today, your caliber, your status, your everything has changed out of what you and your team have done. People will respect you from today. Even those who didn't want to give you a loan, they'll now give you loans. If you are not married, those who didn't want to get married to you would just get married to you automatically. That is the power of doing correct things. Continue doing good. The reward awaits those who will do it. But to government, the Minister of Finance is here. Honorable Bat, you are my friend. They think of deceiving us all the time and telling the people of Teso, we shall compensate you for the animals. That one is also not coming. Today, I know you are going to say, Madam Speaker, we shall do it. And you will not do it. I'm not saying you. I'm saying the Minister of Finance. We will not tolerate this deceit anymore. Madam Speaker, this is the house. We are the ones who appropriate. If we have taken a decision, Sorota has a flying school, it should be elevated to an airport now. Put an airport there by the side so that the flying doctors fly. And Soroti is seen. Dr. Kure Nikumi is doing a wonderful job. Orthopedic. It's like God put a star in terms of health. It's like God selected Teso to have the brains for medical activity. If you come to Kumi, Madam Speaker, those people are there. You go to Serere, you have seen them. In Soroti, it is a catchment area for the powerful brains. What else do we need to do? Let us applaud these people. Madam Speaker, I thank you so much. It is the time for us to recognize good effort because that is what the Bible says. When we do that, we get blessed. And it's a very, very important thing. And I want to applaud my colleague, Honorable Okupa.
Thank you.
You're now qualified to be Right Honorable Member of Parliament. Yes, yes, because of his seniority. And he has done a good job. Thank you so much, Right Honorable Speaker.
Druyaru, Honorable Miranda, Azza, Kenneth.
Thank you very much, Right Honorable Speaker. Right Honorable Speaker, I want to take this opportunity to thank Dr. Joseph and his team, to thank the move of this motion. Right Honorable Speaker, I also want to thank you in a specific way because you have given way for this motion to be discussed. In discussing this motion, many Ugandans have come to learn, they have come to know that there are some issues down there that which Ugandans can manage even under very difficult conditions. Right Honorable Speaker, God was speaking. God is speaking to this country. When this doctor sat down, organized himself, build confidence and faith to carry out this surgery, separating a child from a mother's liver, that is very, very complicated. Something that nobody would imagine that a Ugandan can do under very difficult conditions. Right Honorable Speaker, having done this must tell Ministry of Health that we have human resource down there that the Ministry of Health is not utilizing properly. Right Honorable Speaker, the Ministry of Health should come up with a strategy to see how they can be able to, get down there to doctors to know how they are working, what work they are doing, what difficulties are they facing in doing their work. I think they should know that they have got much work yet to do down there. Right Honorable Speaker, for example, in Mulago, yes, those people chased away that child and the parents. We must know that in Mulago, there has been good work done. There are people who come from down there, they come in very difficult condition, but they have ever gone back smiling. Let us take that specific incident and investigate why it happened so. Maybe those people wanted to communicate to this country that certain things are not easy in Mulago. They needed help. I think when you take Cancer Institute, for example, in this country, they give chemotherapy free of charge in this country. Yet when you go out of this country, you will get chemotherapy very expensively. I have experience of people who move out of this country to go and get chemotherapy out of this country. They end up even coming back to Cancer Institute. That shows that even the Minister of Health.
Okay, Honorable Sarah Tumuranda. Just close. Close your sentence.
Okay, thank you so much, Right Honorable Speaker. Right Honorable Speaker, I want to conclude by saying that health needs to be given attention. Like right now, when you go to the north, very many people have got eye problem. I think I am also a victim. When I came to this parliament, I was not wearing glasses, but these days I am wearing glasses. So the Minister of Health should know that there is a problem down there. Right Honorable Speaker, thank you very much for giving me this opportunity.
Honorable Sarah Tumuranda.
Thank you, Madam Speaker. Right Honorable Speaker, I join the House to congratulate Dr. Ipodoi and the entire team for having done a commendable job of saving the life of that kid, a future responsible Ugandan. Our doctors here are capable of doing what the doctors in India, UK, and elsewhere can do. A lot of taxpayers' money is used to take people abroad for medication. Yes, we have doctors who can handle well such cases. Right Honorable Speaker, if I may ask, why is government failing to fund government hospitals? Why? The minister is around. Honorable Minister, why is your ministry failing to facilitate all its hospitals, our hospitals, the government hospitals? If hospitals are well funded, there would be no much congestion in Mulago and the other referral hospitals. It was a shame on Mulago management when they rejected that child, when they rejected the twins. Madam Speaker, Dr. Ipodoi may not know how Ugandans here and abroad feel about him and his team. All Ugandans are very proud of Dr. Ipodoi and his team. Thank you very much for the work well done, Dr. Ipodoi. Long live Dr. Ipodoi and the team. Long live Roti Hospital. I thank you, Madam Speaker.
Honorable Azza Esiangu, then Honorable Namuganza, followed by Honorable Karubanga, Finance, and then Health.
Thank you very much, Madam Speaker, and my dear colleagues. Dr. Joseph and your members, the people of Moyo have sent me here to congratulate you and to sincerely thank you and give you credit, if not distinction, for job well done. You are role models, you are mentors, you have left a legacy which can never be rubbed off. You have made history in Uganda. Please, once again, congratulations. Now, my request to the government of the Republic of Uganda, through the minister. Honorable Minister, may we go loud and clear to the powers that be that we should have the following. Number one, improve on the welfare and the motivation for all the health personnel across the board in the whole country. Equip all the hospitals with medicines, X-ray machines, scanning machines, recruit all the newly qualified doctors. There are so many roaming all over, but they are jobless. They're not being recruited. And let us try to work hard in order to avoid what we call brain drain, as most members have just been talking about. Secondly, Madam Speaker, may we work hard in order to upgrade most of the general hospitals across the country. We have one in Moyo. Moyo is a general hospital, and we will be happy if it can be really uplifted to referral status, because the population in Moyo is really increasing because of the refugees. Really will be happy to have that. Moyo should be made a referral hospital. Lastly, Madam Speaker, we have Muni Technoscience University. We have Mbarara University. Can we have faculties of this university spread all over? Like in West Nile, we have Muni Technoscience University. We can have a faculty in Moyo so that we can train as many doctors as possible so that we can have very many medical personnel to work on our people. I thank you very much for giving me this chance, and safe journeys back to Soroti, where you're coming from. May God bless you from now and forever. Thank you very much.
Thank you, Honorable Siambu. Then we'll have Honorable Namuganza. Then Honorable Karuanga.
Thank you very much, Madam Speaker. I want to take this opportunity to thank you sincerely for according this motion enough time. It's a sign that you're really committed to the health of Ugandans. Madam Speaker, Dr. Podoi is one of the professionals we rank highly in TESO. There are so many others that we cannot mention all here. But I want to thank him for the commitment that he has showed to serve the people of this country and especially TESO. I want to thank you with your team and most sincerely your dad, who is here to witness the work that he did to raise you up. Thank you, Muzei, for raising such a useful Ugandan. Thank you very much. Madam Speaker, I've interacted personally with Dr. Podoi, but he's a doctor who's down to earth, very professional. He only doesn't do his work, but he loves doing what he does. Madam Speaker, Dr. Podoi has a clinic. He runs in Roti, but there is something exceptional with Dr. Podoi. You will never get Dr. Podoi in that clinic when he's supposed to be at the main hospital doing his work. You will not get him. They will tell you, wait, he's busy. You can only see him at 6 p.m. You can only see him at 8 p.m. Normal office hours, you will not get him in his clinic. That is how professional he is. And we really, really appreciate. Now, Madam Speaker, I don't want to castigate Mulago Hospital. I want to thank Mulago Hospital for giving Soroti Regional Hospital opportunity to show that they can carry out such operations. I want to congratulate Dr. Podoi. Now we know that the next conjoined twins, they should take them to Soroti for Dr. Podoi to operate on his team. This is an opportunity for us. And that means, Madam Speaker, we need to equip the hospital if we have to do better. If Dr. Podoi was a soldier, Madam Speaker, by now, he would be a general. What can we do to say thank you? Appreciate, thank him, congratulate him with his team. We can only make life better for people and the rest of Ugandans by equipping our health unit and facilitate the doctors to do their work. Without equipment, Madam Speaker, there's nothing they can do. And doctors and nurses are very pertinent. Madam Speaker, Madam Speaker, there is something special about Dr. Podoi. In TESO now, we don't worry about prostate cancer. We don't worry. And you know how deadly it is. I happen to have one of my people in my constituency who had a problem. He was at advanced age. And they recommended him for operation. It's Dr. Podoi who worked on him. He's very normal and very healthy now after I worked on him. That is how special he is. So he's a very good asset that I want to employ your government. That, Madam Speaker, like you said, we have approved a lot of loans here. Can we see one coming, especially for health sector, to specifically address the challenge of the regional hospitals? Because that is the next area that we need to consider.
Thank you, Honorable Namuganza.
Thank you, Right Honorable Speaker. for according this motion very significant time for us members to appreciate our medical team from Roti Regional Hospital. Right Honorable, when I saw the story of the conjoined twins, it was sad and good. Before I saw the good side of it, I was saddened because I saw one of the babies when the color had started changing. And I'm like, what is next now? Only to hear shortly that our medical team had done very tremendous job. A very big thank you to you. I remembered two statements, common statements, Right Honorable and colleagues, we normally use in our casual talks, that the good you do comes back to you, and the reverse is true. But also the other one is that where there is a will, there is always a way. You have shown that. And I'm very sure when you are doing that, when you are going to perform that surgery, a lot of things must have crossed into your mind. But you say, let's do it. If they to die, at least they die when they are separated. And you took that firm stand as per your profession. We really recognize the challenges the hospitals, RSS centers that are facing. And for me, I also join my colleagues saying that since we are the ones who budget, at least let us make sure that our hospitals are fairly equipped, and also enhancing your salary, which has become a song of His Excellency the President. Now that we all appreciate the role of science, I'm very sure this financial year coming, we shall put a lot more emphasis on the science. Thank you, Right Honorable, for the opportunity for us to contribute. And
Minister of Public Service, I hope you can respond to the issue of the chauffeur-driven cars for the consultants, which have not yet arrived.
Thank you, Right Honorable Speaker, for giving us this time to pay tribute to these patriots from Roti Regional Referral Hospital, headed by Dr. Opodoi James Joseph. Right Honorable Speaker, I'd like to thank Honorable Elijah Okupa for this motion, and thank the colleagues for raising these issues which touch the pertinent Ministry of Health. Right Honorable Speaker, I want to touch mainly those on which dwell on the human resource, that is public service. As government, it's true, we've had challenges in salary enhancements and the harmonization, but the ministry got a directive from cabinet, and we came up with a pay policy. But this pay policy is going to be enhanced in a phased manner. And I'd like to report that indeed, at the end of the implementation period, the salaries of workers across government will be favorable. And I want to say that we've had that phased implementation and prioritization, starting with the scientists. As you know, His Excellency has been emphatic on this. He wanted to address the issue of brain drain. And yes, members have raised the issue of, especially the doctors. They are somewhere, but we know we'll get there. In line with that, Right Honorable Speaker, our ministry is carrying out major reforms to address some of the challenges we have. And one of those reforms, we want to have a national salaries review commission, which will ensure that this national cake from the treasury is shared equitably. So that's one of the reforms. I'd like to say that we have challenges, indeed, as the ministry, to do with workers in the public service. Some of these challenges include corruption, attitude, and of course, low staffing levels. But all these, as I've said, we have major reforms we are planning. We are going to handle them. On the issue of rewards, I've had colleagues proposing, yes, it is good. In the public service standing orders, we have the rewards and sanction framework. And this one is a responsibility of all accounting officers to recognize outstanding performance in employees. This one can be done. We don't have to wait for Labor Day. We don't have to wait for Heroes Day. We don't have to wait for Independence Day. This provision is there in the public service standing orders. And what we realize that most accounting officers, they've instead concentrated on the sanctions. They don't go to the rewards. And yet in the private sector, you see rewards coming up, recognition of outstanding employees for the month, for the year, being emphasized. All right, Honorable Speaker, I'd like to touch the issue of the car. In the public service standing orders, we have categories of employees who are entitled to certain benefits. Indeed, the standing orders provide for a chauffeur-driven car, but if that car is not yet available, we provide for mileage. So it's the responsibility of the accounting officer to ensure that every entitled officer for that provision is given the mileage allowance in case the vehicle is not there. I'd like to thank the colleagues for raising those issues which touch public service. And what I can say is that slowly by slowly, we'll be there. And indeed, I want to thank this team of doctors and other doctors who are not here, who are doing tremendous work in other hospitals, in the regional referral hospitals, and other scientists. And what I can say is that government will make sure that you are remunerated well, and you'll be soon recognized for the good work. There is the issue of promotions. Within the service, we provide for promotions, and these promotions occur when we have gaps. You have to have a vacancy, and this promotion is applied for in a competitive way. So what I can say, because of your outstanding performance, the eyes of the appointing authorities have seen you. So you should not lose hope. I want to thank you.
Okay, thank you, Minister of Finance.
Thank you very much, Madam Speaker. I want to thank Dr. Epodoi and your team for the selfless service, for your distinguished contribution, and the spirit of patriotism you have shown in your profession. We are all grateful to what we have done, And this not only done to the people of Teso, we are proud of you as the people of Uganda. And because of that, this parliament has accorded you now more than 2 hours of recognizing your contribution. Now you join the Hansard of this parliament for what you did to humanity, and we are very grateful. Madam Speaker, many people raised the issues of financing for health. And I know the minister who has drawn up a strategic plan for the next 10 years. We are slowly making steady progress on financing for health. As you have seen, and I know you also participated in the opening of the great hospital we put at Murago. We have allocated now more than, in this financial year, more than 30 billion to finance the scientists, in line with what His Excellency the President has been talking about, that the future belongs to science. We need to finance science and scientific research. For example, our own scientists are working out research in issues of COVID, issues of setting up a facility here to do our vaccines, and we have provided some resources, more than 30 billion, to work on this. The budget is here with us. The Minister of Health has made some proposals. We passed it at Cabinet, and now it's within our hands. I urge colleagues to look at this budget. Let us make the painful decisions to make sure that the priorities of this country are financed. And I know that when it comes to that Minister of Health and health issues, Parliament will stand with the proposals that were put in the budget. So I want to thank you, Doctor, and your team for the contribution that you continue to make. I know even when people talk about medals, talk about money, handshakes, and all that, I know that you did this not because you are looking at those things. You did this because you wanted to save lives. And I urge you to continue doing that. These things might come, might not come. That's not an issue. An issue that we have a Ugandan doctor born in Teso, an OB of Honorable Okupa, who has made a contribution and a mark in the history of our country. Thank you, and may God bless you and bless your work.
Honorable Minister of Health.
No, Okupa.
To the Honorable Minister of Finance. Madam Speaker, a honorable member here made an allegation. So we want the minister to confirm or deny that Minister of Finance has cut the budget of Minister of Health by 9%. Because if that is so, it is him, by the time the budget comes to the committee or here, unless you are saying we have to make painful decisions and reverse that for us to get back to the normal original budget and possibly even up it by the 9% up. Madam Speaker, the Minister of Finance should not leave without clarifying that point.
Madam Speaker, the Holy Book says, the Bible, that there is time for everything. Today is a time to pay tribute to Honorable Epodoi, and we should concentrate on that. Other issues will come later. Thank you.
Minister of Health.
Thank you so much, Right Honorable Speaker. I want to begin by thanking you sincerely for allowing this motion be tabled on the floor of Parliament by Honorable Cooper, and the time that has been accorded. That shows the importance you attach to this motion, and that shows the passion, Madam Speaker, you have for the health service delivery and improvement in the health service delivery. Thank you. On behalf of the health sector, allow me to really also add my voice to support this motion to pay tribute to Dr. Joseph Epodoi and the entire team from Soroti Regional Referral Hospital and the entire Soroti Regional Referral Hospital staff. This is a clear, Madam Speaker, extraordinary work, extraordinary service, which we call service beyond self. This is a clear demonstration of commitment and the level of professionalism that this team have demonstrated to this country. We are here today to appreciate this team and the entire staff from Soroti Regional Referral Hospital. We are also thinking about very many people who are not being appreciated, who might have done similar job for this country. Madam Speaker, this kind of rare condition is what sells most countries out there. This kind of rare, extraordinary work is what brings up uniqueness of healthcare service delivery in other countries. And today, the fact that Uganda has been listed among the countries who have successfully done such kind of operation, we call ourselves very lucky and we are a proud country. And we hope this will scale up the country to another level. We continue with this kind of example. Right, Honorable Speaker, this extraordinary service, which has been demonstrated by this team today, has brought on this floor of Parliament a lot of debate and discussions on the 6th building block of health service system, the health system. We've talked about the service delivery in holistic manner. A lot has been talked about the human workforce for health, the financing the health sector, leadership and governance in the health sector, essential medicine and supplies, and lastly, health information system. Allow me on this note, Madam Speaker, to thank my colleague, the honorable members of Parliament, for first of all, appreciating and really uplifting the healthcare professionals today on this floor of Parliament, despite the challenges and the working condition they go through. I also want to thank my colleagues, the honorable members of Parliament, for really appreciating and recognizing such services that have been done in this country. Most importantly, this shows clearly the healthcare professionals in Uganda, they are the best we have. They are the competent healthcare workers with all the excellent skills and right attitude, among others, that has been demonstrated today. Right, Honorable Speaker, I visited Soroti Regional Referral Hospital twice this year, before the end of this year. Indeed, what colleagues have discussed here is true. The infrastructure are old and they're in sorrow state. Actually, Madam Speaker, personally, I had to stop one of the structure which was meant for rehabilitation, which already the contractor was identified. The time I went, they were supposed to start work, but the fact that that structure was condemned, I was made to stop the construction renovation work. Madam Speaker, even the constructed new structure like the private wing, which had 2 floors, if you enter into that structure, the work done, there was no value for money. Within a year or two, buildings, you see floors already getting out, structures are already collapsing, poorly supervised, poorly constructed. Madam Speaker, I therefore really wish to say and apologize for the people of Soroti who get service from Soroti Regional Referral Hospital for the state of that infrastructure. Having said that, Madam Speaker, previously, when this parliament gave permission for capital development funds for regional referral hospitals, the Ministry of Finance was directly dealing with the directors of regional referral hospital to identify projects for implementation using the yearly approved capital development fund. Until such a time, referral hospitals were putting in place huge structures that could not get finished. Until last year, the ministry wrote to Health, Ministry of Finance, stating clearly that any infrastructure development in a referral hospital must pass through Health. And from that time, we call all the directors of referral hospital. We looked at the existing infrastructure development region by region, hospital by hospital. Some of them are maternal child health, others are accommodation for staff, others are private wing, others are interns hostel. There were no uniformities, there were no equity, there were no distribution in terms of having similar structures and similar costing. And from that time, we all agree the existing infrastructure in all the regional referral hospitals should be completed. And that is why last financial year and this coming, all the money has to be reallocated to ensure structures that have been started under Capital Development Fund, Madam Speaker, they has to be completed. Number two, Soroti Regional Referral Hospital, from last year's meeting, we concluded needed affirmative action because of the structures which are in the hospital. That means the hospital needed new infrastructure constructed, not even rehabilitation as it is happening in other regional referral hospitals. So, Madam Speaker, from last financial year, the ministry took over the issues of infrastructure development in referral hospitals to ensure we have equity in resource distribution, uniform infrastructure, and uniform costing so that we have value for money and we have time frame for the project to complete such that we can move from one project to another. So I want to state on this floor Parliament, so Roti has already been given affirmative action given the structure that is currently existing in that hospital. What I can state here, Madam Speaker, is we need as ministry to bring to your attention on this floor, when is this affirmative action beginning? Are we getting all the capital development funds from which year? Or are we getting loan elsewhere like Yumbe or like Kayunga to ensure that we have a new refurbished state-of-art hospital for that region? So that is what probably we need to bring to your attention so that you can be in the picture what exactly this affirmative action is about. Madam Speaker, having said that, allow me to also echo about the issue of administration. Indeed, it is true, there are gaps in administration, as colleagues have stated, the administrator or the hospital director. We discussed that even while I was in Soroti, and I want to request that my ministry is sorting that out because we want to ensure that we have a substantive hospital director who could really get committed and to ensure he worked for the people with all heart and love. Madam Speaker, there was issue of healthcare professionals, which is not adequate. Indeed, it is true. When we look at scheme of service, when we look at the structure of the referral hospitals, these were made many years back. By that time, the population was pretty small. but now the populations have increased. So right now, together with the Ministry of Public Service, we are restructuring, but leave alone restructuring. There are structures which already in the regional referral hospital, like the senior consultant, special grade of different level. Even when there is up those positions in the rural or upcountry hospitals. Those are the challenges we go through. Nevertheless, Madam Speaker, the issue of salary, my colleague has talked about it. The working environment, indeed it is true. There are facilities which are lacking equipment, and our ministry this time around, we are trying to put infrastructure and also to equip the facility so that the doctors, the nurses, the anesthetists, whoever is there can work in a friendly environment. Of course, Madam Speaker, it's not only that can motivate the health workers. Accommodation has been one of the priorities that we have put in our agenda to ensure how best we can provide accommodation in a phased manner for the healthcare workers. Promotion has already been mentioned by my colleague. I'll not want to say much, but important to you, Madam Speaker, Health Service Commission has recently advertised positions for all these consultants in the regional referral hospitals. Our prayer is that people take up those positions and they're posted to those referral hospitals. Even interviews have been ongoing last month and this month. We pray that some of the gaps, though not all, some can be filled and we improve service delivery. Madam Speaker, when I visited Roti Regional Referral Hospital, as I said, I took some actions, but sometimes I need the support and the back from the politicians and colleagues. We're talking about infrastructure, but there are other preventable diseases that colleagues can support us. When you enter in Roti, the time I went, every border in Roti city is packed in the hospital. It is packed in the hospital at a fee, and the person has carried there asked for 1,000. You park your border there, you go and work, you know it is safely. Yet there is infection control measures, nobody thinks about it. When you enter the hospital, bicycles in the whole town are parked in the hospital. When I took decision, Madam Speaker, to immediately stop the motorcycles and the bicycles out of the hospital, I hear behind me, the politicians stand around, defying my directive to allow the borders to go back to the hospital, to allow the bicycle back to be parked. You think it is a market of borders in the hospital. When I stopped the construction of the latrine, which was put on an old existing structure without foundation, after me, I hear it was continued because the politician thought I was doing the wrong thing. When I stopped the renovation of the condemned building, after me, it was a problem. So I want to request the politicians from Roti and the region. Sometimes we also need your support. We need your support to speak to your people. There are certain things that is within your means that you can do and help to improve the state of our hospital. We do not want Roti to be a market of motorcycles, not a market of bicycles, but we want it to look like a regional referral hospital, live along the old structures, Madam Speaker. Concerning the training of health workers, already as
Thank you, Madam Speaker, and I would like to thank the Honorable Minister very much for the information she's giving us. There is a concern you're raising, Madam Minister, about the involvement of politicians or the assistance of politicians. And of course, these politicians are members of parliament and LC5s and so on. I wanted to get clarified whether when you were going there, you brought to the attention of these politicians what was happening in order for them to ensure that they talk to the local people to understand the importance of having that problem fixed.
Thank you, Honorable. I would also love if you could be specific. Is it the politicians at the parliamentary level or the local government? But also, we have very good working relations with you, because I remember when I raised the issue of the masks, we acted very fast and we did receive. I wish we had shared that information when you got that information, that these directives that you gave were defied, would have been able to work together. But you, for now, maybe if you could really specify who those. But we are ready to work with you to ensure that Roti Regional Referral Hospital is a regional referral hospital. I know personally, even there are issues I've raised with the PS last week regarding that hospital, regarding the health center, theories of the shared construction work, where we're even appealing to you that I wish you would take up and send a team. The first work you did under which you gave Sayani contractor to do for the hospitals did very well. But the way these days, I don't know how you recruit, because when I brought it up with the district, they say, no, this was sent to from the ministry. So I think we need to sit down and see how to resolve these issues here.
No, I think we need to conclude. Members, this delegation needs to go back to Soroti.
Right, Honorable Speaker. Honorable Minister talked about that new building for, is it private wings, and it is storage. So the work, in 2 years, it will not be of use. It's not enough to say you want to apologize to the people of Soroti, but who is accountable for that study work? Are you just going to leave it like that, to go like that? Or you make the people who did the study work to account? And it can only reach IGG if you people also sign it. Who should be accountable for that? Thank you.
Thank you so much, Madam Speaker, for the study work. I passed information to the responsible people. They are trying to investigate it. That I was just bringing it that because what is happening in Soroti. Thank you. Madam Speaker, I just want to mention that there is a lot of work taking place in terms of construction, like under JICA, we have constructions in Arua, Lira, Guru Regional Referral Hospital, and even the other hospital, they are having other construction work taking place. And we will make sure really there is value for money. Last but not least, the issue of Mulago Regional National Referral Hospital, as my colleagues have stated, certainly we will need a report well investigated on this issue. As of now, I cannot just give information without clear evidence of why they did not work on the child. But what I know is already a report has been asked. But Madam Speaker, it is on record that so far, 3 sets of congenital twins have been done in this country. 2 were done previously in Mulago. 1 was a referral from Kagadi. The other one was referred from Kole district. It's only that the level of the conjoint, the physiology, the structural attachment varies. Otherwise, it's on record. The country has performed so far 3 sets of conjoined twins.
But Minister, were they also dead? These ones were, they also, one was dead. Because this one, the specialty is that this one twin was dead for 6 days. The others were alive, isn't it?
The two, at least the last one, the one from Kagadi, when I visited up to Heart Institute, that time was still alive. I've not yet followed up, but at least the last one I visited.
No, what we are saying is that this is the first time They have performed an operation when one of the twins is dead and the other one is alive. That's the difference.
Yes, that is true.
Yeah.
Thank you.
Okay.
As I conclude, Madam Speaker, the issue of DHOs, the DHOs is already, as you know, the Local Government Act mandate the local government through the District Service Commission to recruit the DHO. The PS Ministry of Health has written several times to them to recruit substantive people in those positions, but will not get tired. Since we've not yet centralized the position, we'll continue to put pressure for them to put substantive people. And as I sit down, allow me once again to thank these healthcare professionals for this very important, extraordinary work. This is a source of motivation, inspiration, and a total commitment that they have demonstrated. I hope this work will inspire many other health workers to improve on the competence, the skills, the right attitude in handling patients with love. And on our part, I pledge as government will try our best to ensure the working environment for these healthcare professionals, especially the equipments and the infrastructure. I thank you. God bless the team from Soroti. Long live Dr. Joseph and the team. Thank you.
Okay. Thank you, Minister. But I hope that next time we are going up country, you inform the members of the area so that they go with you and assist you with the local politicians.
I'll do that, Madam Speaker. Thank you.
Okay. Honour members, originally we had only planned for 30 minutes, but paying tribute to 16 professionals is not an easy job. That's why we decided that let's use this day to honor these 16 people. But Honorable Ogwad had something small she wanted to do.
Right, Honorable Speaker, I stand to move an amendment to the motion which we have just discussed, so that we highlight the key areas for implementation. Before I do that, Right Honorable Speaker, I want to register the power of God. In this situation, they say every bad thing happens for good. And I think the conjoined twins is going to bring a revolution in the health sector. Hearing what the Minister of Health has stated in this house, which is on record, and listening to what the Minister of Finance said, that there is time for everything, which means this is now the time of action and implementation. I really want to acknowledge that, and I hope the record will remain permanent so that we'll call you accountable for those statements.